Have you ever heard of vitamin K2? No, not K1, the one found in leafy greens. We're talking about vitamin K2, the nutrient quietly sitting in the background while calcium, vitamin D, and magnesium steal the spotlight. But here's the shocking truth. A deficiency in vitamin K2 might be silently damaging your arteries and weakening your bones, even if you're taking other supplements religiously. In today's video, we're diving deep into this hidden vitamin that most doctors don't even talk about. You'll learn what vitamin K2 really does, how deficiency shows up in your body, the life-threatening risks of not getting enough, and most importantly, how to fix it before it's too late. So let's start with a simple question. What is vitamin K2? Vitamin K2 is a fat-soluble vitamin that plays a critical role in directing calcium where it belongs, into your bones and teeth, and away from places it doesn't belong, like your arteries and kidneys. It's like a traffic cop for calcium. Without K2, calcium may harden your arteries instead of strengthening your bones. Scary, right? There are two main types of vitamin K, K1 and K2. Vitamin K1 helps your blood clot, and most people get it from leafy greens like spinach and kale. But K2 is much harder to come by in the average diet, and it performs completely different roles. Vitamin K2 exists in several forms, but MK7 and MK4 are the most studied and beneficial. They activate proteins that prevent calcification of arteries and enhance bone density. Now, let's talk about the symptoms of vitamin K2 deficiency, most of which are often misdiagnosed. Do you experience frequent cavities, even with good oral hygiene? That could be a sign that calcium isn't being deposited properly in your teeth, a K2 issue. Do you have stiff joints, back pain, or low bone density? You might think it's just aging or lack of exercise, but without K2, calcium can't integrate into your bones effectively, leading to osteoporosis over time. Do you or someone you know have a history of heart disease, high blood pressure, or arterial plaque buildup? That may also be linked to a lack of K2, which helps keep arteries clear by activating a protein called matrix GLA protein, known for preventing vascular calcification. And here's something many don't know. Vitamin D and calcium supplementation without K2 can be dangerous. Yes, dangerous. Without K2, calcium gets absorbed but has no guidance. It may end up calcifying your soft tissues like arteries and joints, increasing your risk of heart attacks and strokes, even if you're doing everything right. Let's look at the science for a moment. A long-term study from the Netherlands followed over 4,800 adults and found that high K2 intake reduced the risk of artery calcification and heart disease by over 50%. That's massive. Other studies show it significantly improves bone density and reduces hip fracture risk in older adults. So why don't more people know about K2? Unfortunately, it's not commonly found in Western diets. The best natural sources of K2 include natto, a fermented Japanese soybean dish, grass-fed dairy, egg yolks, and organ meats. But unless you eat these foods regularly, especially natto, you're probably not getting enough. Now let's talk solutions. How can you increase your vitamin K2 intake safely? First, try to get it from natural food sources, natto, highest K2 MK7 content, grass-fed butter and cheese, especially Gouda and Brie, egg yolks, pasture-raised, liver, chicken or beef, sauerkraut, and other fermented foods. But for many, supplementation is the easiest and most reliable route, especially for older adults or those with health conditions. Look for vitamin K2 MK7 supplements, ideally paired with vitamin D3. The combination helps calcium absorb better and ensures it ends up in the right places. The typical safe dose? Anywhere from 90 to 200 mcg per day of MK7, but always consult your doctor before starting any supplement. Now, let's address some common myths. Myth 1. I eat spinach, so I'm fine. Spinach has K1, not K2. They are not interchangeable. Myth 2. Calcium and vitamin D are enough for bone health. Not without K2. Without it, calcium could be harming you. Myth 3. I'm too young to worry about this. Arterial calcification starts in your 30s and worsens silently over decades. Prevention begins now. Let's wrap this up with some simple takeaways. 1. Vitamin K2 is essential for bone health and cardiovascular protection. 2. Deficiency is extremely common, especially in Western diets. 3. Symptoms are often silent or misattributed to aging. 4. You can fix it with the right foods and supplements. It's not too late. So if you care about your heart, bones, and overall health, don't ignore this. Vitamin K2 may just be the missing link in your wellness puzzle. Thanks for watching. If this video helped you understand something you hadn't heard before, make sure to subscribe to Global Health Guide, give this video a thumbs up, and share it with someone who takes supplements. They need to know about this. Stay informed, stay healthy, and as always, take charge of your health.